my lateral ventricles, 1 and 2. Also note, these are the two largest, okay? And if we get production, we have to make sure that the lateral ventricles, 1 and 2, meet third ventricle, which will meet fourth ventricle, which will begin to have some flow down into the spinal cord, back up to where we can reach. What do y'all see all the way up there at 8? Our cauliflower. Those arachnoid granulations, because as we get to this area, arachnoid is named that way because of the blood supply. It actually looks like we have the webbing that occurs. So, make sure to note that we have the return, because if we're producing it, we are supposed to make sure we get a return, because it's not stagnant. It has to keep moving. We have to get it back to the blood supply, and we have to get rid of those wastes that were picked up. For every heartbeat, roughly 15%. How many times a day does your heart beat? Oh my goodness. I can't do that kind of math. If I'm going to have 70 beats per minute, there's 60 minutes in an hour. So I got to have 70 times 60. Is that right? Y'all follow me on the math now? 70 times 60. And then I got 24 of those hours in a day. I got to take that number multiplied by 20. I'm sorry, I cannot do that math. Okay? Every heartbeat, 15%. It consumes 20% of my oxygen and my glucose. And then we got the doctor telling us glucose is so bad. Cut them carbs. That's no fun. I won't cut carbs. I try to be like, well, wait a minute, I use my brain a lot. Can't I have the carbs? No, you can't. But why? So anyway, because the only molecule for energy is glucose. That's it. Oxygen, let me think about this for a second. Do you think your nerve cells ever stop? No, they are busy. They need a lot of energy, they need a lot of oxygen, and they're trying to maintain their pH. So, a lot of stuff. There can simply be a very small amount of interruption of the blood flow. We're talking seconds, okay? If it goes more than that, chances are it will lead to irreversible brain damage. But you know how, okay, when I was raising my son, and you know how you're always given the advice when they're throwing a little temper tantrum and holding their breath and everything. And I can remember, I guess it was like my mom or my dad one. And of course, you know, he was throwing a little temper tantrum, holding his breath, and I'm getting ready to like, you know, ah! And they're like, leave him alone. Don't worry, leave him alone. And sure enough, because you know, they and hold the breath and everything, okay? they'll eventually either fall out and start breathing again, or they'll realize holding their breath is not fun, okay? Because have you ever, like, been in a situation where maybe you weren't having your breathing correctly? Maybe you really weren't taking deep breaths like you should, and you kind of get, woo, all right, kind of dizzy or whatever, or if maybe you haven't eaten in time and that sort of thing, maybe your glucose levels were low or something, your brain feels kind of foggy and that sort of thing. This is the reason why. Because of the demands, okay? And when anything interrupts that, like for example, a stroke, okay? Anything that interrupts that blood flow for more than just a few seconds usually will end up in brain damage. In cases where the blood flow can, if there is no blood flow for 1 minute, 2 minutes, chances are you're going to end up with irreversible damage. So disrupting that blood flow is not a good thing. But then again, our own blood can be harmful. We can have situations where we have purposely put something into our bodies that will affect this tissue. But we can also have situations where we might have been exposed to something, like air we breathe, okay? We can have toxins that we didn't purposely put there. Sadly, damaged tissue of this organ does not repair. All right? This is not a cell of the body that can repair or replace. Does that mean that's the case for the entire nervous system? No. But it is the case for the brain and the spinal cord. Depending upon something in the peripheral nervous system, depending upon where the damage occurs, will determine if there is repair. For example, I was cut for the hand surgery. Right now, all those little nerve endings at each cut, there are 3 of them, okay? At each cut, right now, they are extremely tender, okay? But I had this hand done back in August. Fine. That's because that little area, which is tiny, okay, that has the ability to heal. Not reproduce, but it has the ability to heal. But as I continue, and as those little teeny tiny nerves meet a larger nerve, meet a larger nerve, meet a larger nerve, and get here, if I had had one of those damaged or cut, chances are tissue it serves is going to be damaged. Does that make sense? Okay, so when you hear that these cells don't regenerate, repair, reproduce, or anything, the answer to that is really yes and no. That makes sense? Depending on where it is. So, what we find, we have a BBS, a brain barrier system. This is what I've talked about, working so hard to protect these cells. We've got 2 points of entry to the brain tissue. I have the actual blood vessels coming into the tissue. And then I have capillaries in those choroid plexuses. Those are my 2 points of entry. They are very well guarded. Very well guarded. They create what we know as the blood-brain barrier. Y'all heard of that, right? Because, do y'all remember that cell from chapter 12? Astro. And I can't say that without thinking about the Jetsons. The dog on the Jetsons. Okay? And I really thought by my age now, I would have the little robots going around and cooking my meals, and that I would have the flying vehicle, you know, because Jetsons was one of the cartoons I watched. And I'm really disappointed that I don't, you know. But Astro, because it looks like a star. Okay? And what this cell does, let me see if it's the next one. That's my astrocyte. This is a glial cell, meaning support. Look at what it does. All these branches that are occurring, see how that, do you guys remember the little feet things? Pod? Okay, podocytes. Do y'all remember that term? Anything that looks like a little foot-like projection? So what they do is they begin to branch out, and they're trying to show us red and blue, arteries and veins, okay? Because they're trying to show, does everybody kind of see the blue right here and the red right here? And what they're trying to tell us, that astrocyte, these projections, the little stars, okay, that are coming off of it, they have these foot-like projections that reach out. Woo! One is around an artery, one is around a vein, okay? That they are reaching out, and before something can move into the tissue, it has to pass through this cell. So hopefully, any type of toxin or chemical or whatever, that cell takes it out before the blood supply gets to the tissue. Does that make sense?
What does it do to take it out?
Well, these cells, if you think back to the structure of a cell, where we've got the plasma membrane, we've got the nucleus, we've got the cytoplasm, and that sort of thing. If it has an attachment to an artery, which is bringing in the blood flow, and if it has something in that blood flow that hopefully it will move into this astrocyte, pass through the transcytosis, the moving across the cell, and get back to the vein and go back to be waste.
Okay.
Okay? That's the goal. But take a break, be back at 10:30.